I'm Dr. Lisa Rodriguez. And before we get started, I do want to just have this disclaimer up for everybody to take their time to read. I am not your doctor. And if I am your doctor, this is not the time where you and I are meeting in an independent doctor-doctor visit. This is for educational purposes only. And if at any point in time you feel like you need actual medical care, I do urge you to seek that and do not take this relationship as a doctor-doctor relationship. Today we're going to talk about MCAS, mast cells, and lipedema and the complexity that exists between them. Remember at our last webinar, we talked about MCAS just lightly, and we said we were going to jump back into it this time around. So the goal tonight is pretty simple. I want you guys to leave with some clarity about what's really driving your symptoms, especially with regards to MCAS and lipedema, and what you can do next. I'm going to try to keep this pretty practical. I'm going to try to talk for about 20 minutes, and that should give us plenty of time for Q&A. Okay? So the first thing I want you guys to understand is that you are not imagining your symptoms. You're not being lazy. And if anything, most of you have been trying harder than most people. You've had multiple diets, sometimes extreme starvation, pushing exercise to the point of burnout, an insane amount of supplements, lymphatic massage, compressions, and you're still not getting relief. So of course, part of you starts thinking, okay, maybe it's me. Maybe I just haven't tried hard enough. But when the real driver isn't being addressed, your efforts turn into frustration. And then eventually you stop trying. So I have another, okay, there we go. Sorry. And when you stop trying, you become totally exhausted. Before we go any further, I do want to say out loud that many of you might be already thinking this, and I don't want your brain to go in all kinds of directions and start rejecting everything that I share with you because you've already another restrictive diet, or even if this makes sense, you're not going to be able to stick to it. I've already spent so much money. I can't waste any more money. If any of this sounds like you're not being negative. You're just experiencing what I like to call a broken healthcare system. Okay. Now stay with me because for the next 20 minutes, we are going to go into the educational part. For the next 20 minutes, this is going to be the educational part. Okay. So decide what the right step is for you. Before we start talking about anything, I need to go a little bit into mast cells, okay? And in plain English, mast cells are a normal, important part of your immune system. They live throughout all parts of your body. They're in your skin, your digestive tract, your blood vessels, your connective tissue, and many other areas. When they sense a possible threat, they release chemicals like histamines and other inflammatory messengers. These chemicals help the body respond to infection, injury, allergens, and other problems. So that is what mast cells are supposed to do. Okay. Now, the problem begins when they become too sensitive or they start reacting to things that really are not dangerous. Think of it kind of like a smoke detector that goes off every time that you make toast. The house is not on fire. Breakfast is just a little crispy. The alarm is screaming. Everybody's running around. The dog is barking. And there's somebody underneath the smoke detector waving a big towel to kind of get the air out. Okay. For many patients, that is exactly what mast cell problems do. The immune system behaves in a similar way. The response is real, but it is so much bigger than it really needs to be. There is no actual deadly threat. So your mast cells are not truly responding the way they're supposed to be. Now, mast cells are not new. This isn't anything that we just learned recently. This isn't something that, we haven't heard of before. Mast cells have been around since the 1800s, and we know about them when a physician and scientist named Paul Ehrlich discovered them. And for many years, mast cells were really just discussed mainly as like allergies and anaphylaxis. Now we understand that mast cells are involved in so much more than just sneezing and hives. Okay. They communicate with your nerves. They communicate with your hormones, with your blood vessels, with your connective tissue, with your digestive system, and even with the microorganisms that live in your gut. So in other words, they're extremely social. They know everybody, but unfortunately, when they become agitated, everybody in the neighborhood goes into an argument. So why does it seem that, we are talking more about mast cells now than we used to before? It's not that magically, mast cells have suddenly reappeared or that we didn't know that they existed. Really, it's because clinicians have become better at recognizing it. 20 years ago, we didn't even talk about mast cells in med school. Like when I went to med school, which was literally 20 years ago, that is not something that I got taught on. There was no education about mast cell activation syndrome. We learned about allergies and anaphylaxis, excuse me, but not in the terminology of mast cell activation syndrome. So for 20 years, we have had patients just go down these rabbit holes of it's all unrelated. It's all your stress. It's all in your head. This is not real. And they've been told this same story over and over again within the healthcare system. So we have to consider also that in the modern world, okay, mast cells are being more triggered by our modern environmental pressures. Okay, we know that there's a lot of more things that are affecting our immune system. Your air pollution, the chemicals, the plastics, the chronic stress that we live with now that we did not live with 20 or 30 years ago, a change in your food. I just heard somewhere that a tomato from 1940, nutrition wise, equals 40 tomatoes from 2026. Okay. The current infections that we're exposed to, the amount of medications that we now take on a regular basis, and the changes that all of that has done to our gut microbiome. So we can't say that these factors have definitely caused the modern epidemic of MCAS, but it is definitely reasonable to understand and recognize that mast cell problems are now more often because today's immune system is dealing with a heck of a different environment that we were not dealing with before or even some generations ago. Now, it's important to make a distinction between twitchy mast cells and MCAS, okay? If you have sensitivities to things that you eat or things that you smell or things that you touch, you might be triggering your mast cells. They might be sensitive, they might be twitchy, but that is not mast cell activation syndrome, okay? Mast cell activation syndrome is a specifically well-recognized clinical diagnosis with a consensus of criteria that has been internationally designed to say, okay, sensitive mast cells, okay, you have labs that apply to this abnormality, and okay, you responded to the medications that manage these mast cells. It's important to also understand that when I say labs, okay, I know a lot of you are thinking, oh, you're talking about the tryptase. No, there's a ton of laboratory markers that can be collected during an episode of mast cell activation, or I have patients that had an endoscopy and their endoscopy biopsy showed that they had much, that it says, innumerable mast cells on the biopsy, or some people are diagnosed with a particular condition during the endoscopy that is like a typical lab finding that's diagnostic of mast cell activation syndrome. So it doesn't have to be like blood levels or urine levels of these markers, although these are the easiest things that we can collect because it's a lot safer to do a 24-hour urine or go do a blood test than it is to go run you through an endoscopy, for example. And not everybody that has mast cell activation syndrome necessarily has symptoms in their GI system every single time. So it's important to understand that the diagnosis needs to be based on a complete clinical picture, not just on symptoms, not just on isolated labs, and certainly not from a social media checklist point that you're like, oh, I have mast cell. So why are we discussing MCAS in relation to lipedema? Okay. And it's important that we go over this in a little bit of detail because this is going to apply to many of you on this podcast or on this webinar, excuse me. Mast cells are a huge and very important contributor to inflammation, and they are found in lipedema tissue. For many years, lipedema was basically described as a abnormal fat accumulation, and that was it. Now we understand that lipedema is so much more complex, and that is a very incomplete description of what this disease really is. It is much more than just fat. It involves inflammation, connective tissue, small blood vessels, lymphatic drainage, nerves, pain pathways, hormones, and even your immune systems. And mast cells appear to be a big part of that picture. Studies that have examined lipedema tissue report an increased number of mast cells in the lipedema tissue, and also the mast cells appear to be more active, even if they're not increased in number. So this doesn't prove that mast cells are causing lipedema, but instead it shows that mast cells may be acting as an amplifier. They are causing your tissue that is already vulnerable to be more vulnerable. So mast cells turn up the volume on your inflammation, on your swelling, on your pain, on your leaky blood vessels, on the changes that your connective tissue goes through, and even on the lymphatic congestion. When mast cells release histamines and other chemicals, the small vessels become more permeable. In English, that just means that they become leaky. Okay, they start to move fluid out of the blood and into the surrounding tissue. And this explains a lot of that swelling and heavy feeling that you get inside your tissue. Okay, mast cell chemicals also irritate the nearby nerves and the nearby tissue, causing your pain receptors to be more sensitive. So this can be one of the reasons why we suspect that lipedema tissue can be painful or tender, because there's no obvious injury, but when you touch it, it hurts. And patients sometimes describe this pain just from like a light touch, or my dog, sat on my lap, or my kid jumped on my lap, or my partner, touched me kindly and it was excruciating, or, I can't have a massage because it is so painful whenever I do. So mast cells also affect your connective tissue. Your connective tissue is basically like the framework that holds the body all together. And certain chemicals released by these mast cells can influence the way that your normal tissue produces collagen and the way your normal tissue repairs. So when this process becomes chronic, poorly regulated, your tissue can become firmer, more fibrotic, and nodular. Again, that fibrosis and those nodules that we see in lipedema are part of why your mast cells are so important. Mast cells also interact very, very closely with your lymphatic system. The lymphatic system acts partly as the body's drainage system and partly as your cleanup network. It removes excess fluid, proteins, debris, inflammatory substances, all kinds of stuff from your tissues. And when your inflammation interferes with your lymphatic flow, it becomes harder for the tissue to clear all that material. But at the same time, that poor drainage then allows the inflammatory chemicals to remain in your tissue longer. So it gets into this kind of frustrating cycle of inflammation interfering with drainage, and then poor drainage causing more inflammation. And so this is why it may be more accurate to think of your mast cells as amplifiers rather than as the sole cause for lipedema. And they usually take an already vulnerable environment and make several problems worse all at the same time. So it can explain why some patients report feeling better when their mast cell activation is addressed. And we have studies where the use of mast cell regulating agents such as cromolyn, pycnogenol, and even Gleevec, which is known as generic imatinib, in low doses has helped women with lipedema address their pain and their symptoms. It is also important to understand that treating mast cell activation or treating your mast cells is not going to cure your lipedema. Lipedema is complex. It is a multifactorial condition, and it is not a curable illness. We try to control the disease, control the inflammation, and minimize the progression. Addressing your mast cells simply reduces one source of inflammation or of symptom amplification, and it is not for everybody. Not everybody has mast cells that are a part of the problem. In the studies, it was only 60% of the mast cell fat that had this elevated mast cells. So it's a very important distinction to make. Just because you have abnormal mast cells or even mast cell activation syndrome does not mean that it is causing your lipedema, but it is just one piece of the puzzle. The larger message here is that lipedema is not just simple fat. It is a condition that requires a lot of systems to be managed: your immune system, your connective tissue, your blood vessels, your lymphatics, your nerves, your inflammatory signaling, and even your nervous system. And understanding that mast cells just give us another way of thinking about the way our patients experience pain, swelling, tenderness, inflammation, and sensitivity. It moves us to a more personalized approach to treatment. And it is more about processing how much does this affect the tissue versus how much tissue do I have. Okay. So when I explore my patients, this is what I look at. I look at a comprehensive patient picture. I don't look at, oh, this is just solved by one single problem. Okay. Now, I don't know how many of you know our story. But for those of you that do, you're going to get a short blurb of it. And for those of you that don't, you're going to get to understand us a little better. So my turning point when I switched from what I used to do to practicing sort of lipedema and mast cell care came when my wife, who was a vibrant, she owned her own business, worked 14 hours, was able to bike ride for 30 miles in a day, went from all of that to debilitating symptoms and not being able to get off the couch. And when things got really, really bad, not only did I not even know what she had, did not know how to treat it. We went through multiple different doctors that had no idea. And when we finally realized what this was after, I think it was years of searching, and we figured out, oh, surgery, this is going to fix it. We just have to remove the lipedema fat. And we went down that road and things just got so much worse, so much harder. And instead of getting better, the pain and the mobility problems continued. And it wasn't until we discovered that inflammation was actually the key and driver to her disease that we started to understand that non-invasive procedures that manage inflammation can help so many women manage their lipedema. So our mission at that point became to offer cutting-edge treatments that genuinely improve my patients' lives. And I am determined to have another voice for medical treatment instead of the community's over-reliance on surgery. Our personal and professional experience has been what built this clinic. The team that we work with, the holistic approach that we use, the way that we guide our patients towards real and sustainable solutions. We are rooted in a functional medicine clinic that targets the root cause of inflammation and treats lipedema without relying on surgery. That does not mean that we are anti-surgery. It means I want to offer you a solution that is long-term, that is going to help you whether you choose to or not have an invasive procedure, because it addresses the whole person, not just the areas where you have a little bit of fat. And it provides long-lasting and real results. Our program, usually people get long-term benefits pretty early on. The cost and time commitment is usually minimal. We teach you, we hold your hand, we walk you through. It is low-risk investment for your health, and it's designed basically for people that are looking for real change. And most of my patients notice weight loss, pain reduction, and inflammation reduction pretty early on. A lot of shifts happen usually in the first 2 to 3 weeks, and they just simply start to get better. They start to be able to do more things, and they get out, they're able to move, they lose 30 pounds, they don't get short of breath. Like, there's all these magnificent stories of patients that we have. And I smile when I say this because I enjoy remembering how they felt before we started and how they feel, quickly, even just 3 weeks after starting. So what I need you guys to understand is that you don't need more willpower. What you need is the system that is designed to help you personally get better, that focuses on a treatment plan and comprehensive symptom tracking, nutrition, and lifestyle guidance. We balance your hormones. We work regularly with you to support you, to monitor you, and together we create a foundation that actually helps healing happen. So no more frustration, and no more I don't know where to go, and no more I'm stuck, going around in circles. We are here to show you a way of getting better, doing your activities that you love, returning to the person that you were before all of this pain without having fear and frustration and without guessing, because the time that we spent figuring out our inflammation and how to treat it is what we are saving you guys. And I can show you exactly how we do that and what tools you can start applying immediately to start feeling better right away. I work with MCAS, lipedema, EDS, menopause, perimenopause. Unfortunately, I've even had parents seek me out for children, young girls, 14, 15-year-olds that are starting to have the symptoms of lipedema. My license does not allow me to see anybody under the age of 16, and a lot of our tests can be pretty tricky at that age, but that's just to say that this can happen to anybody at any time. The way we work is basically, it is physician-led. We test, we stabilize, we repair, we track, we adjust, and then we repeat. And if during your process, we need to adjust early on, later on, we do it. I don't throw 40 supplements at you because you're complex, and I don't just put my hands up and give you a piece of paper and say, here, go do this. We start with getting you clear answers. We start dealing with the problems to calm your inflammation immediately. And once your inflammation is calm, then we go to the root cause. And we do this because it's important for your system to not be hyperactive. Because if your system is already reacting to everything that we do, throwing more stuff at it does not equal more progress. It just equals more flares. So my job is to make things easier for you, less guessing, more like a design personalized plan that respects your body, your sensitivity, and the way you respond. So the step one is testing, and not everybody gets every test under the sun. We're very specific. We use 3 targeted tests, and usually it's based on your symptom picture. We do like to run a food mediator release, MCAS-oriented food reactivity test, because a lot of women that have lipedema and have hyperactive mast cells, whether they do or do not have mast cell activation syndrome, have a very intense response to histamine. And so when we check for these mediators that are what the mast cells are triggered by, these foods that react, eliminating them early brings down that inflammation and that reactivity pretty quickly. And then we're able to reintroduce foods, and then we're able to tell you what that does. So the goal is to notice patterns, not to put you on some jailhouse, diet that you can never consume this ever again. And from there, we usually run a GI map because most of us have inflamed guts or imbalanced motility. And as your histamine loads up in your gut, it also creates a ton of dysbiosis. Some people have what's called SIBO, or small intestinal bacterial overgrowth. Sometimes it's called long intestine bacterial overgrowth. So all of these kind of play a role, and a lot of them are dependent on your inflammation and your gut dysbiosis. So once your mast cells are better, your inflammation is down, your histamine load goes down, then we switch to try to stabilize your gut, fix whatever we find in there that might be causing dysbiosis, and then we put you sort of on a stability program for your gut. And some women need a little more. Some women need hormones, because we know that those changes in estrogen can cause massive growths of lipedema. Estrogen is a pro-inflammatory agent or hormone from the perspective of mast cells. And so low and slow is super important for women that have lipedema. And so some women do need this. There's other patients that don't. Other patients need a totally different approach, like a nutritional status or even genetic testing, right? We want to know what genetic abnormalities within their cycles are causing them to have problems. So because everybody is different, we don't treat everybody as sort of like a checkbox. And we try to find things that are keeping your inflammation stuck. And so we stabilize those, and then we readjust. And if we need to, we retest. And if we need to, we readjust and we retreat. And so we use a track and adjust system that helps everybody kind of stay feeling better. I was looking for the right word, but I don't have the right word. It just helps you feel better. It helps you feel supported. It helps you feel that we're treating the entire body, not just your flares or not just your symptoms. And when we go into repair, that's the part that becomes much more sustainable. And that's actually where Angela is now, right? She's in the repair. She's in like, "Ooh, we found this new thing that we can now use. Let's go try it and see how much better we can get you," right? Like that's the repair mode where we've gone through fixing the hormones, fixing the gut, fixing the nutrition, looking at the genetics, and now we're like, okay, so what else can we do? We've done the red light, we've done the hyperbaric, we've done the ozone, and it's like, oh well, now we want to look at senolytics, now we want to look at stem cells. So that's the repair mode. That's where it can get fun for a lot of people to sort of get even closer to being their normal selves, the way they were before this disease even attacked them. And I do want to make sure that everybody kind of understands that when we look at the system in lipedema and in my clinic, we specifically go through a support system that doesn't just provide you with with answers to some things. We look at your mindset, we look at your nervous system, we look at your movement, we look at your diet, we look at your lifestyle, all of it, because all of those big rocks, if you alter each and every single one of those environments, you get a lot of really small changes. And when you stack them all together, it turns into an amazing effect, and your body is much better. So sleep, hydration, environmental markers, all of that is part of what we look at within our system. Now, I want to be careful with everybody here that's listening. I want to make sure you understand I'm not promising that everybody's going to get better. I'm going to cure your disease. I'm not making that kind of nonsense claims. I'm just saying we can make you feel better. We can make you have less pain. We can decrease your inflammation. We can guide you to your root cause, and your root cause might look different than somebody else's, and your treatment might look different than somebody else's. But what's important to understand is that we stop guessing. We start with a sequence of testing, tracking, and treating, and that helps a lot of people get out of the circle of lipedema, and it decreases your flares. It decreases your days where you're flaring up for no reason. It decreases the reason why today you woke up and you're, volatile and swollen. And it's like, I didn't do anything to gain 3 pounds I went to sleep. Why did I gain 3 pounds between last night and this morning? Right. And you pay for it later. And it's important that those things that we do help you become more predictable and have more predictability in your life. Because when you live with a disease that from one day to the next, you can gain 3 pounds from not knowing what you did, or today you have a headache and tomorrow you have excruciating leg pain, having predictability is a huge win for most people. And even having small shifts in symptoms makes people feel so much happier and so much better. And it is so nice to see. By not taking any action, it is important that you guys understand that you're going to let this disease progress. You are dealing with a progressive illness. Lipedema will continue to become more fat, more inflammation, more pain, more areas of your body. And this progression then leads to other things happening, like insulin resistance or PMOS/PCOS. Whenever I say that, I now feel like that formerly Prince, the symbol. But anyway, PCOS or PMOS, those things can start to happen to a lot of women that just let the lipedema kind of grow. And I don't want you to miss an opportunity to move forward and improve. Imagine what your life could feel like if you had, less pain, less stress, less swelling, more mobility, more tolerance, more predictability, and just better. Okay. If what I've shared with you tonight makes sense and you're saying to yourself, yep, this is bigger than willpower. I need a plan. This lady knows what she's talking about. I like the way she's describing this. I like, working with somebody that's going to tell me exactly what to do. Our program does exactly that. It is a high-touch 5-month physician-led program that stops the guessing, stops the being alone and puts you right into constant checking, monthly physician checkings, bi-weekly individualized coaching, weekly office hours, labs, interpretations, personalized plan based for you, free messaging support, flare tracking, pacing plans, food, all of it. And if you choose to work with us and you're ready to go, just scan that Clarity program solution here. And if you're not and you still want to chat some more, you can scan this one and book an appointment to see me. That is it. I am done talking. I'm going to mute myself and listen to any and all of your questions. Unmute, Michelle. I'm going to answer this question from Canada. Do I feel that there may be a non-surgical cure in the future? I don't think that there's a cure for lipedema. I want to be very honest with you. There is no such thing as a cure. If you're expecting a cure, it's like expecting a cure for diabetes. So I don't use that word. We don't cure people. But there is a way that you can control the progression of the disease. And once you've controlled the progression of the disease, you've controlled your inflammation. If you want to remove your existing fat, then that is when surgery for fat removal becomes extremely important and quite necessary so that you can then return to have a body that now can live with the low inflammation state that you've created, right? Because if you have, 300 pounds and 100 pounds of lipedema, okay, and you manage your inflammation and you go down 100 pounds of weight, but you still have 100 pounds of lipedema, you're not going to get that down with just controlling your inflammation. At some point, you're going to need that removed. So we don't cure it, but you can certainly manage your inflammation. And like I said, there's a ton of ways of doing that. You can look at a functional medicine doctor in your country or somebody that's willing to do functional medicine. If you actually don't look for a doctor, I'll take that back. If you don't look for a doctor, you can find a functional medicine provider. Their license allows them to see patients internationally without actually being licensed in that country. So I can't see you in Canada, but if you have a chiropractor that does functional medicine or a PA or a nurse practitioner, they do not have to stick to the same license requirements that a doctor does. And so you might be able to find somebody like that in the US that understands lipedema and understands functional medicine and might be able to help you manage your inflammation abroad. And I know that not all the tests are the same, but I'm sure that there are tests that can be done. You can come in from Canada to any major point in the US, get your tests done. Miami, they stay for, X amount of time. The kit gets sent to the hotel they're staying at. When they check in, they grab their kit. They've already made their appointment. And they go get their blood work and then they fly out, 2 days later and I talk to them on the computer. So that's a way of doing it. Never daily. MLD daily, I mean, shoot, if you have that much money, that's like amazing. But I would not recommend that you spend $100 to $200 on a therapist that does MLD daily. Now, if you have compression pumps, you can do your own massages, you can do vibration plates. All of those things can be daily activities that you do to manage your lymphatics. There's even one where you can put like your leg infrared sauna for 5 or 10 minutes. If you don't respond to saunas, some women respond negatively to the heat of a sauna. But if you don't have that side effect, even that will help you as well. But yes, you should be doing something daily to drain your lymphatics. I have a caveat to that is if you meant right. And so there's two things, mast cells and vibration plates and mast cells with heat. So some women respond very, very poorly to vibration plates. They get hivey and itchy. That means your mast cells are reacting to the vibration. I don't recommend that you keep pushing through. The same thing with saunas. Women that get prickly when they're in the heat of a sauna should not continue to push through. That is your mast cells telling you to stop. So I need you to stop. And then as far as MLD daily, you're going to start to notice that as you decrease your inflammation, you need less and less MLD because you are packing your lymphatics with less gunk every day, and it's easier for your lymphatic flow to be more natural. As a woman with migraines with aura, my doctor will not prescribe hormone therapy. Are there any options to support hormone regulation? I don't believe that soy is a support for hormone regulation. That's been disproven a million times. If you have migraines with aura and your doctor will not prescribe hormone therapy, that is not a set in stone. What happens with migraines with aura is that there is data to suggest that women that have migraines with aura have a higher predisposition to developing clots in their brains, they're not strokes. They're actual clots in the brain, in the venous sinuses of the brain system. But that risk is no different than if you were on birth control as a child. If you were on birth control and now you have migraines with aura and you never had a clot, you're not going to have a clot from hormone replacement therapy. So you have to talk to somebody that understands the functionality of HRT and migraines and risks and benefits. And honestly, it's a risk benefit. If your doctor says, hey, here's the data, here's the numbers, here's your risk, and you said, forget it, I'm in, I need this, I'm tired, I need my hormones replaced, I don't care if I die, I don't care if I have a stroke, then your doctor should be working with you to provide you with what you need and not limiting you because of a generic statement of migraines with aura and hormone replacement therapy. So that's if you have symptoms of vasomotor symptoms like night sweats, hot flashes, things like that. So Veoza is a prescription medication that is non-hormonal, but it does not help you with MCAS or lipedema whatsoever. It just helps you with your vasomotor symptoms of perimenopause and menopause. It does not help you with reducing your risk of colon cancer, improving your dementia risk, and minimizing your colon cancer risk. It does not minimize your cardiovascular risk. So it doesn't do any of that. It just controls your vasomotor symptoms. So I'm not sure. I just want to make sure I clarify that for you because I wasn't clear on what your question was. You've been on tirzepatide for 2 years. How does that affect MRT testing? It does not. And yes, tirzepatide already reduces inflammation. The only thing that affects your MRT is time. And time is because every 10 years, our body goes through a renewed immune system. So this is why a lot of people used to have a problem 10 years ago and don't have a problem now, because your immune system changes every 10 years. So if your MRT test is more than 10 years old, we do recommend that you repeat it. I am a 5. I am a 5, which is the highest number. MRT doesn't even go above 5 for soy. And I haven't consumed soy since I was 15 years old. So it is not a matter of consumption. It is not a matter of being on a medicine that decreases your histamine. This is a test that simply looks at how your body responds to a food and what your body does to it. And tirzepatide does not affect it. Also, any of you that think you have mast cell and run up to a doctor that says, oh, you have to stop your meds to get your testing, run away. You are not to stop your medications that is controlling your MCAS to get your testing. That is not necessary. And that can trigger a massive deregulation of your symptoms and can make you very, very sick. What you could do is when you're on your meds and you have a flare, then you can go get your testing done because that will then give you the abnormal labs that your doctor is looking for. But to reduce your medications or stop your medications can be very dangerous for many women with MCAS that are well controlled on their drugs. I can only imagine if like Angela stopped her meds and we went back to 2020, where we were up for 2 hours of the night with her almost needing to have a tube down her throat to breathe so I can have a test tell me that it's abnormal. I would not recommend that to anybody ever. And anybody that deals with mast cells on a regular basis, consensus 2 criteria understands this. Martha, oh, I see. You're coming in as Amber, so I apologize if I called you the wrong thing. I'm curious if you work with a patient that has already down the road and have been seen by other MCAS specialists. You still start at the beginning with all new testing, or do you pick up where others left off? I don't need to reinvent the wheel. I mean, if you have a bunch of labs and you have a bunch of tests and you already know you have MCAS and you've already tried. I mean, I had one lady talk to me to see if I could help her, and she had already been through I think it was 4 different MCAS doctors. She had tried H2, H1 blockers, ketotifen, cromolyn. She had been on Singulair, which is Montelukast. She had been on I'm blanking on the herbal supplements, quercetin, NAC, selenium, and she named a bunch of other drugs and nothing had helped her. And she had gotten to the point where her mold was getting worse. She had tried mold medicines. All they did was trigger her mast cells and she couldn't do anything. And she said, I have a doctor that's going to put me on Solair. And I said, go for it. Go for your Xolair. Like I don't have to start from scratch. I don't believe in wasting time, energy, or money for anybody. So I do pick up wherever others left off. What I will tell you is that we do not work in one-offs. In other words, I do not see you and then 6 months later see you again. My treatment is functional medicine. So I bring you in, you're in a program for X amount of months, we stabilize you, we find what works, we get you better, and then we go into repair mode, and then that's it. So if you're looking for somebody that's going to try different meds, I'm fine with that. If you're looking for somebody that's just going to, oh, I want to see you today, see what you think, and then see if you'll treat me, I don't treat one-offs. I'll see you, but I will not treat one-offs. I treat people that are in a program, that I hold their hands, I walk them through an acute moment, get them better, and then you can stop spending money on doctors and you can keep going on your own. And if you need us, you can always return for a flare. Like we just went to the Dominican Republic and we both got exposed to things that we have not been exposed to in a long time. And we came back and we were flared up. And so that's a moment where I would assume a patient of mine would have the same situation. And so I let them come back and we can fix them. It usually takes 1 to 3 months to get people restabilized, to refix whatever gut you got from the water you drank or the food that you ate or whatever mold you fed because you started, eating a bunch of sugar or a bunch of bread or, a bunch of whatever, right? So all that stuff that's expected. We don't fire you, but I'm saying I don't do one-offs. Do you have experience with long COVID and myalgic encephalomyelitis comorbidities with lipedema? I do have experience with long COVID. I have not had myalgic encephalomyelitis comorbidities with lipedema, but that is a mast cell triggered problem. So your long COVID has been shown to be related to basically just like Epstein-Barr virus, Lyme, Bartonella, Babesia, parasites, COVID, other coronaviruses. They trigger your mast cells. They become hyperactive, and then you start having all kinds of side effects from having mast cell activation syndrome. Your trigger was long COVID. Can you get rid of your long COVID? Some people say yes, some people say no. It depends on who you want to believe and how far down you want to go down that rabbit hole. As far as myalgic encephalomyelitis, I've not dealt with that. Doesn't mean that I'm not willing to take care of you and learn, hear what you have to say, hear how you feel, and figure out how we can work with you. How do I feel about GLP-1s in management of MCAS and lipedema? I prescribe them in my clinic. That's how I feel about them. I do not prescribe high doses of GLP-1s because they have a tremendous deleterious effect on your gut microbiome. But I do use low dose and microdose tirzepatide specifically. I do not prescribe the new one, which I'm not even going to say because I can never pronounce it right. That's only available in Mexico because it is not FDA approved and I am not going to lose my license over untested drugs. But I do prescribe tirzepatide. I do not like semaglutide. The side effects are too high in comparison to the benefit. That calm mast cell is no longer going to trigger everything that we just discussed 20 minutes ago about pain, swelling, fibrosis, nodules, lymphatics, etc. So yes, GLP-1s are a very important and a very useful tool in patients that have MCAS and lipedema. Is it the only thing that I do? No, I do not. I do not just prescribe GLP-1s. I'll give you a GLP-1 in the conjunction of bringing down your inflammation, looking at your food, looking at your gut, looking at your hormones, looking at your cortisol, your adrenal, et cetera, et cetera. We see patients on telemedicine in 45 states plus DC. I'm told that I can't say 46 states because DC is not considered a state. So I am not licensed in Massachusetts, New York, Pennsylvania, Rhode Island, and West Virginia. Otherwise, I can see you. I do not take insurance. And some insurance companies do accept a super bill. Some insurance companies do have coverage for functional medicine. And if they have coverage for functional medicine, you can get the program reimbursed after you pay me. So your insurance pays you, you pay me. And that's between you and your insurance. I have a couple of patients like that you can also put it on your HSA card. We are located in Beaverton, Oregon. If you look us up on Google, I can promise you that you can find me, my phone number, and my address because I just literally lost my wallet yesterday, and some lady Googled my name, found the clinic, found the number, called me, left me a voicemail, and sent me an email. So we are in Beaverton. We see patients 1 day a week there as of right now, but as we grow and need to make more room, we will have more room to see more patients. Now you guys, I think that's all the questions in the chat. If anybody wants to unmute. Oh, more? Oh, shoot, sorry. Oh, I see. Do I like pneumatic pumps for lipedema stage 2? I like pneumatic pumps for anybody that needs them. I don't care if you're stage 1, 2, 3, or 4. Some patients need them twice a day. I have a patient that has to use them twice a day because she hasn't managed to control her inflammation enough and her swelling enough. And if she doesn't do her pumps 45 minutes twice a day, she can't walk the next day. But pneumatic pumps are super essential. And I partner with Tactile Medical. The Tactile Medical tech rep, is super nice in my area. And she has helped me get the Tactile Medical has this really cool, it's about this big, like the size of a computer pump that you can travel with. It's a really neat travel pump that I have a lot of patients with lipedema that travel across the country, and their flare-ups on planes are insane. And with Tactile Medical, we've managed to get them that pump approved, and they're able to carry that on the plane with them, and they'll pump while on the plane, and they arrive in so much better state. It's insane. Word of warning, MCAS plus vibration plates can cause, whole body hives. Yep, agree. Some women, some not. It depends on the way your mast cells respond. GP, Gyn, and Endo all blew me off when I asked for hormone levels. They all say that testing is useless. I'm 54. Okay, so this is Beilstein. Is that right, Beilstein? Okay, so yes, testing is useless if you are going to get hormone replacement therapy as a standard patient. 100%. The Menopause Society and the GYN Society of America says there's no need to test. Why do we not test? Because we did not test you when you were normal. So we don't know what your level of low is. I want y'all to understand something. When you get a blood test for your estrogen level, the normal range is from 50 to 830. That is a hell of a normal range. So how can I tell you that if you're 300, you're normal? Did I test you when you were 800? No. So we don't test to start hormone replacement therapy. If you just want BHRT, all you need to do is start. Now, if you have lipedema or MCAS and you want to start hormone replacement therapy, all of my patients, 100%, I start them on a compounded cream, and I go low and very slow because I don't want to create that same bump that you get when you get pregnant and wham, you get that super high spike of estrogen. So I do it to where you don't even realize that you're getting estrogen. It does take a little longer. Your symptoms last a little longer, but your lipedema doesn't flare. Your MCAS doesn't flare. And then I'm not dealing with the 20 pounds that you gained that are now more painful and more swollen. The caveat to that testing is if you are looking for a hormonal problem within your ovaries, that is different. And that is a functional medicine aspect. That is not to start you on hormone replacement therapy. That is to look at whether or not there are other issues within your ovarian function and your adrenal function, meaning your cortisol and your estrogen and your progesterone, and then all of the, and your DHES, and all of your metabolites from those, because there are women who have a propensity to metabolize estrogen in a negative way that makes them more prone to developing breast cancer when it goes in one direction. So that's what the Dutch test is for. That is where you want to get tested. It is not to start hormone replacement therapy. So your doctor should be able to start you on meds, period. And I would suggest doing a compounded cream of estrogen and progesterone. And as far as the estrogen goes, I'm careful to say, if you've been pregnant and you had a great pregnancy, then I recommend that you use a product called Bias, which is bi-estrogen. So it's got two forms of estrogen. It's got the pregnancy estrogen and it's got the youth estrogen. If your pregnancies were god awful and you were sick as a dog, then I do not recommend Bias, because that's how you're going to feel when you start the hormone replacement therapy. Can you please speak on the impact of GLP-1s on lipedema? Is that more than what I already said? Because GLP-1s help lipedema on two levels. It decreases the inflammation from the MCAS, which decreases the pain, the swelling. And then it also helps a lot of women with food noise. It helps a lot of women with hunger. And it does help a lot of women lose non-lipedema fat. It also helps a lot of women that have a lot of food noise and have difficulty kind of staying on track because all they think about when they wake up, when they walk into the kitchen, when they walk into the bathroom, or when they're, changing their kid's diaper is what's my next meal. That has helped. GLP-1s have helped those women tremendously because you do have GLP-1 receptors in your brain. GLP-1s have been tested in drug addicts. They get given to them. And it's not that they're no longer drug addicts, is that they no longer have that noise telling them to either drink or consume drugs. How do you feel about taking PEA and NAC? What's PEA? Whoever asked this, can you unmute yourself and tell me what you mean?
I can. Can you hear me?
I'm sorry, say that again.
Can you hear me? Sorry,
Yes.
my mic is weird. It's like palmitoyl. Here, I'm looking it up right now. It's a very long, crazy name. But it's supposed to be for reduction of inflammation. Hold on, real quick. Sorry. My browser is taking forever.
Oh, palmitoyl you know
Yes,
what? I've never heard of that.
ethanolamide, yeah.
Okay, so I've never heard of that being studied or used for lipedema. So I will not speak to that because I don't know. As far as NAC, yes, I use NAC on my patients. I use NAC personally for my personal inflammation. So yes, I do use NAC regularly. A lot of women need NAC also for their gut. So that's a big one that helps as well. So Angela's telling me that we're at 5:01 and we have our VIP webinar coming up. So we have to get off of this one, but she wanted me to touch base on diet. So sounds like there's a ton of questions on diets. Here is a diet that I recommend. I recommend the diet that works best for you. Whatever that is, knock yourself out. We follow a specific diet. I do not expect you to follow mine. What I recommend in my patients is I test you. I tell you what histamine response you have to those foods. I want to be clear that it's a histamine response, not an IgG or IgE. If you consume gluten and you die, just because my test doesn't say that you don't consume gluten, you don't get to consume gluten, okay? It doesn't test for that. Those are three different forms of tests. IgE is one reaction, IgG is another. Histamine and chemokines and cytokines are N mediators. That is another. So if you're allergic to something over here, I do not want you to consume it here. But that is the diet that I recommend, a diet that is tested. I do not believe in random elimination diets that run all off of IgG because that has led to a lot of people being poorly nourished and have bad gut microbiomes because you get told from an IgG test that you have all these allergies and you can't consume these foods. And all that IgG says is that, so yes, you were exposed to it. That is called an IgG reaction. And I do not recommend IgG food sensitivities. Most of you know when I eat soy, I blow up like a balloon. Or if I eat gluten, I fart like a beast, or I get diarrhea, or I get hives, or my psoriasis gets worse. I had a patient saw me that every time she had gluten, her hidradenitis suppurativa would flare up. So she controlled her migraines and her hidradenitis by controlling her gluten. So that's not what this is about. So you guys know yourselves pretty well. I do not believe in any kind of specific diet for any patient. I believe that you eat whatever makes you happy, doesn't inflame you, and feeds you and nourishes you. That's how we work our diets on this program. If anybody's interested in the program or booking a call with us, you can scan these or you can email us, complete the form also on lipedemawarriorclinic.com. I'm going to start the other webinar. Hopefully we'll see you guys next month. Again, it'll be likely the last Wednesday of August, same time, 4 p.m. Take care.